Welcome to the Fitness Pain-Free Show, where I help physical therapists learn how to get their clients out of pain and back to training in the gym. My name is Dan Pope, and I'll be your instructor. I'm a physical therapist, coach, and fellow meathead. I love training just as much as you do and want to help you get all of your patients out of pain and back to the gym where they belong. So first and foremost, thank you so much for your support. You allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. I love fitness. I love lifting weights. This is the Fitness Pain-Free Show where we help coaches and physical therapists like you get your patients out of pain and back to training. If you are watching this on YouTube, please hit that like button, comment, and subscribe to the channel. If you're listening to the podcast, please give a 5-star review. It's much appreciated. So, if you want to go that extra mile and support the channel even further, please consider subscribing to my premium membership, Fitness Pain-Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. So think Netflix, but for trainers and physical therapists. It's premium content from yours truly. I make all the content on there, and it's similar content to the show, but way more in depth. It's updated monthly. I've been updating this thing for the past 5 or so years, and there's a lot on there. There's 100 plus webinars, ebooks, and complete guides. You also have access to a private Facebook group to have all of your questions answered by me. You also get a chance to decide upcoming podcast topics. So if there's something you really want to learn more about, hear me go in depth about, let me know. I can do that. And you can get started for just $1 for a week-long trial. And after that, it's a recurring membership of $9.99. All right. You can cancel anytime. All right. I won't be upset if you do. And if you want to get started, all you need to do is head to fitnesspainfree.com, click on the programs link, and then click on the Fitness Pain-Free Insiders online library and get started. All right, so we got a fun one here. Should you use manual therapy as a physical therapist? Let's go. All right, so this is obviously a controversial subject. I want to give you a little bit of my opinion and why I use manual therapies as part of my treatment. But here's the argument. So manual therapies, they provide short-term pain relief, and they last very short periods of time, sometimes just minutes, right? Oftentimes these are small improvements, and they may be clinically significant, but are they really clinically relevant? There's a great study by Chad Cook, or his commentary, 2011 Journal of Manual Manipulative Therapy, and it's in the show notes if you want to check it out. And his argument was that, yeah, these are clinically significant results in these studies, but how clinically relevant are they? They're not going to provide a huge effect, right? So that's one shot against manual therapies. So the other piece is that manual therapies tend to be no better than exercise for long-term outcomes. I got to tell you, I included a study here on manual therapy for the neck, and it just showed that there is no difference between manual therapy and exercise, but there's a lot of research out there. I definitely recommend you check it out. Again, I'll put that study in the show notes. So here's the thing. If I am going to get the same outcome long-term by doing manual therapies versus just doing exercise, then why would I, right? And that makes sense too. That's a valid point. So the other part is that manual therapies are widely misunderstood in our culture. And I'm talking about from a patient perspective. Patients tell me all the time, like, oh man, we need to break up that scar tissue, right? That manual therapy is getting out all that bad stuff, getting all that lactic acid buildup out, right? That's keeping me in pain, right? I got to tell you, I tell folks all the time what the manual techniques I'm doing are doing for them, but they still come back and say like, man, I think you're breaking up that scar tissue, right? So whatever reason, it's really tough for people to comprehend in our culture, and it's just widely misunderstood, right? And the other thing is that some patients may think that they need it, right? They may think they need to go to a physical therapist or chiropractor to get their neck realigned or their spine realigned, right? And that's the only way they can get out of pain, and they won't improve without it. And obviously we know that that's not necessarily true. And if you guys are interested, I took this information from the Journal of Dan Pope's Personal Experience, January 2021. That'll be in the show notes as well. Obviously that's a joke, guys. It won't be there. Here's the other thing. Manual therapies have a neurophysiologic effect. We know that when we do a manual technique that can reduce inflammatory markers, it can decrease spinal excitability and pain sensitivity. It modifies cortical areas involved in pain processing, right? So it does stuff. But are these real changes, right? Are we changing the muscle? Are we changing the tissue with our manual techniques? And because we're not necessarily changing the tissue, oftentimes manual techniques get discounted, right? Because they're not doing the same thing strength training does, right? Or an eccentric, where we're truly lengthening tissue, right? We're making a tissue stronger. So that's another knock against manual therapies. The other piece is that in many studies, and there's a lot of them out there at this point, manual therapies have a similar improvement to pain and function as a sham procedure, right? So like manipulation, if you do take someone's neck to end range and just hold it for 30 seconds versus you actually manipulate the neck, you're going to have an improvement in both of those folks, right? So then the idea becomes like, oh, wow, what we're doing is just a placebo. And the thought from there is like, well, is manipulation valuable? Is it real? It's just a placebo. Why do I even do that, right? And if you want to see this research, I'll include that in the show notes as well. So the other argument against manual therapies is that they cause patient reliance, right? Patients are going to need us in order to get better. And this is not great because it shifts that locus of control. So basically, patients believe they need to go to someone to get manipulated, to get soft tissue work, to get dry needling, whatever it is, so they can actually get better. And the problem with that is that we know that's not true. People can become self-reliant. If they do their own exercises, they have behavior modification, they can get better without a physical therapist, right? And to be honest, I couldn't find any medical literature that shows that manual therapy causes reliance, right? But I've certainly seen this happen, and I can definitely, it logically makes sense. I can see it happening for sure. A physical therapist can say, you need my techniques in order to get better. A chiropractor can say the same. You need to come back every month for the rest of your life so that your pain stays at bay, right? We know this isn't necessarily true, and it certainly can happen. Right? Here are some other important considerations before we get down to whether or not you should actually use manual therapies in your practice. So patient and provider expectations are going to influence the outcomes for your patients. So if you utilize a technique a patient has a positive belief towards, let's say an individual really likes manipulation, right? And let's say they've had a positive experience in the past with manipulation, we know that they're probably going to have a better outcome with manipulation, okay? So this means that maybe we need to push the treatments patients have had success with. I can't tell you how many times I've had a patient where I thought I did a brilliant job with my diagnosis, my plan of care, my exercise selection, and gave them what I thought was the best care. And they come back and tell me, you know what, Dan, I think the reason why I'm getting better is because I'm using this stim pack every night. You know, I think the heat pack on my lower back with the stim is really helping me. Let's keep doing that. And, you know, in my head, I just want to be like, what are you talking about, guy? Come on, like, come on. It can't be the heat pack or the e-stim, really. But in reality, that's what the patient believes, and they're having a good experience with it. So we know that to be true. And the other piece is that, you know, if we give the patient a positive expectation of treatment, they're probably going to have a better outcome. We have some research that shows this, right? And I included an article by Bishop et al. That talks about this. I've also referenced Joel Bialowski quite a bit in this presentation. And if you want to read some of his information, again, I'm going to put that in the show notes. But I really highly recommend you read this because it's going to give you some good information about whether or not you should be performing manual therapies. But if I tell a patient, like, look, I have this treatment, it's called dry needling. I put this needle inside your muscle. It's definitely going to help you out. I've had a ton of success in the past, and I think you're the perfect candidate for it. They're probably going to have a better outcome than if I say, hey, there's this treatment, it's called dry needling. Sometimes it works for people, but majority of the times it doesn't. I don't think that you're the right candidate for it, but we're going to give it a shot anyway. Who knows, right? It might help. That's not going to have the best outcome, right? So if we talk up this treatment and we give it a positive outlook, then we're probably going to get a positive outcome with it. So the other piece is that therapeutic alliance is very, very important for our outcomes. I got to tell you, people love manual therapies, all right? How popular are chiropractors, massage therapists, acupuncturists? I can't tell you how many people just absolutely love these folks. They have a very, very strong therapeutic alliance, right? And here's the thing, if you have something that's going to really help to build a therapeutic alliance, maybe we should consider using it, right? I'm obviously not going to force it, but if people really, really desire that, and that's going to improve my therapeutic alliance, I'm going to give it a shot because I know that that's going to improve my long-term outcome, right? And lastly, patient expectation is going to influence the outcome. We already talked about this before, but if the patient expects improvements, they're going to have a better outcome, right? If you have a previous positive experience doing a manipulation or dry needling, they're probably going to have a good outcome with the same treatment again, right? I can't tell you how many folks have told me, yeah, I'm a really good responder for dry needling. I just do really, really well with it. And this is not just in patients. I've had physical therapist students to tell me like, yeah, I love dry needling. I just respond really well to it. And I got to tell you, that's very, very true in my own experience. I've had folks that seem to do extremely well with a certain intervention. Just like, oh, when you needle my upper trap, it feels phenomenal. I feel really, really great after you do that, right? And the other thing is that some folks do not have a positive experience, right? And, we're going to talk about this a bit later, but maybe we don't needle those folks. Maybe we just work with the folks that have a really good outcome from the specific treatment. And the other thing is that provider expectation is going to influence the outcome. Like I said before, this treatment will help you versus not sure, we'll give it a shot. So if I really talk up my treatment, it's going to help me have a positive outcome. And again, therapeutic alliance, very, very important. If I have a better alliance, I'm going to have a better outcome. If I have a poor alliance, I have a worse outcome. So at the end of the day, what do patients want? So generally speaking, when someone comes to see me or someone comes to see a physical therapist, they generally want to get out of pain. And that's usually the most important thing. They want to get out of pain. Secondarily, they want to get back to their activities. And lastly, they really want to figure out how to stay pain-free for the long haul, right? And this is what I generally see with the large majority of my patients. So how might manual therapies fit into this equation? Well, what's the solution? So like we said before, manual therapies provide short-term relief. And like we said before, short-term relief is not long-term relief. If we just do manual therapies versus exercise, the exercise is going to give us that long-term relief. So why do we end up doing the manual therapy anyway? Well, I get headaches from time to time, and I'll tell you what, if I just sleep well the following night, I know my headache's going to go away. But that's going to be, 10 to 16 hours later. Sometimes I have a headache in the morning. I don't want to have an entire day where my head is killing me because I know if I take an aspirin, it goes away just like that, and it's gone. And manual therapies can sometimes do that, right? If you have someone that's in a lot of pain, you do the right manual technique, they may feel phenomenal afterwards. And that is exactly the reason why that patient came to see you in the first place, right? And the other piece is that they may revert right back to the norm. So you help them revert back to the norm more quickly by applying that manual therapy, even though the long-term outcome is going to be the same, right? The other piece is that when someone comes to see you, and this is especially true for really, really painful folks, sometimes exercise just makes them more painful, right? And there's a great argument to be made for folks that are really in pain, and if you get them moving, they feel better. Yeah, you need to push that exercise. And I'm going to push exercise regardless of whether or not I decide to do manual therapies. But oftentimes, exercise just makes people feel worse. And when they're coming to see you, we're looking for something to make them feel better. And manual therapies do that oftentimes, right? And lastly, we want to give them that long-term solution anyway. If someone's coming to see you, I'm going to try to give them the short-term and the long-term. And I'm going to educate them about the long-term as well. I'm going to give them some sort of exercise intervention, and I'm going to do some sort of behavioral intervention or education. Like, look, it's okay that your back hurts right now. The area is just sensitive. Let's not sit down as much as you normally sit just because your back is flared up. When you sit for long periods of time, it bothers you, all right? So temporarily, let's stand a little bit more, and eventually we'll get back to sitting. So I give them the exercise, I give them that behavioral intervention, and I also give them that short-term relief. So the other piece is that, is manual therapy perceived as helpful for the patient, right? Now, we know that manual therapy is sometimes not giving a very clinically meaningful result. But what I will say is that in my personal experience, I've seen a lot of folks that get a ton of relief from manual therapies. And I see some folks that get zero relief from manual therapies. And I see some folks actually get worse with manual therapies, right? So at least in my mind, if I have an individual that does extremely well from a manual therapy perspective, yeah, I'm going to keep doing it. If they get no change whatsoever, I'm not going to waste their time. And if it makes them feel worse, I'm certainly not going to waste their time, right? I'm not going to try to make them feel worse and just tell them like, it's helping you. This manual therapy is what you need. Trust me. No, if it's not working, I'm not going to push it. All right. So right there, you can see that there's going to be some folks that maybe get it and other folks that just aren't candidates. So the other argument was that getting a manual therapy is no better than exercise for a long-term outcome. But at the end of the day, I'm going to let that patient decide. I tell them, like, look, if we don't do manual therapies and we just give you some exercises and you don't come in regularly for manual techniques, you're probably going to have the same outcome in the long term, right? And then the patient can make the decision and say, you know what, I like the manual therapies. It's helping me. I'm going to come in regularly for a little bit because I feel like they're giving me a good effect. Right? And they know, right? We're not duping them. We're not telling them like, look, you need this manual therapy. We're saying, hey, the manual therapy can be helpful, but it's not going to change your long-term outcome probably. And they can make that decision, right? So now I'm not duping that person. I'm letting them make their own educated decision. At the end of the day, I'm still going to exercise with them. I'm still going to educate. I'm still going to modify behavior. If I can throw a little cherry on the top and give them a manual therapy that's going to make them feel better, I'm definitely going to do that. And it's probably going to help with that therapeutic alliance. So how about this whole idea that manual therapies are widely misunderstood in our culture, right? So someone, and this happens to me every single day of the week, someone comes in and they're like, hey, are we breaking up scar tissue? Is this scar just really painful and we just got to get rid of it? Are we just getting lactic acid out, right? And of course, I lie to them and I say, yes, you need this manual therapy in order to get better. Joking, kidding aside here, I educate them on what manual therapies do. And I tell them, look, this is probably going to provide some good short-term relief. It's helped a lot of folks that I've worked with in the past. And if it's not helping you that much, then we'll just ditch it, all right? And then most patients, they want to try it. So we give it a go, right? And the other thing is that patients may think that they need it. Right? I can't tell you how many individuals I've worked with that have gone to a provider for years and years, and anytime they're back here, it's like, oh, I need to go to my chiropractor to get realigned. So these folks think that they need manual therapies in order to get better, right? We know this is not the case. This is tough because you're directly disagreeing with what the patient believes in, and oftentimes this kind of destroys your therapeutic alliance, and sometimes the patients never come back, all right? So you have to be careful about that. But I do think it's important that we educate folks and say like, hey, these manual techniques can be really, really helpful. And yeah, alignment is probably really important for you. But the best long-term solution is probably going to come from doing some sort of consistent exercise program. We have plenty of research to support this. We can do the manual techniques on top of that, but we need to make sure we modify behavior and we give you some exercise, right? That way we're breaking this weird cultural misunderstanding about manual techniques, right? Telling what they need to hear, but we're still trying to go along with their own beliefs and not trying to tell them that they're an idiot for going to their chiropractor for years and that they need to stop doing that right now. The other issue here, and this is an important one, are we causing patient reliance by doing a manual therapy? And I can definitely understand that argument, right? So the patient does not need us to improve. We know that. We're just a guide. We're going to help them get out of pain. We're going to show them the path, right? And what we're trying to do is foster a positive locus of control. We're trying to get patients to believe that they can improve themselves, right? So if someone's too reliant, we're going to have to treat them more frequently and they're going to feel like they need to come back, right? And this is a problem. However, if we educate patients and just let them know, like, look, these manual techniques are a short-term thing. They're going to help you get out of pain probably. If they don't, we can scrap them. The thing that's going to help you in the long term is an exercise program, right? And changing your behavior. Then they're not, I think, as apt to be reliant on you. And again, I couldn't find any research about this, but at least in my mind, if you're really educating your patients, right, you're telling them and being honest about what manual techniques do and don't do, they can make that decision. Right? And at the end of the day, people are still going to go to massage therapists. They're still going to go to chiropractors and acupuncturists because they like it. All right. And it's okay to give an intervention if they like it. Now, if you work in let's say an insurance-based clinic, I'm a cash-based clinic, so I can kind of do whatever I'd like to do. I can really work with the patient and give them exactly what they desire, right? And you can't do that in most insurance-based models. Then you may have a problem. Right? Then you may want to make sure that you're giving that absolute gold standard treatment and not getting that person to be as attached to manual techniques potentially. All right. I can see that argument both ways. At the end of the day, if I really fully educate someone and let them know what the manual techniques do, I feel very comfortable doing them. And I think they are beneficial. Right. So At the end of the day, should you use manual therapy? I'll tell you what, this is up to you, and I'm sorry I can't give you the answer to this. I really wanted to talk about this because I feel like a lot of new grads especially and newer clinicians are very confused about this. I think there's a lot of guilt and shame associated with doing manual therapies, right? There's this idea out there right now that you shouldn't use any manual therapy, and if you do, it's a disservice to the patient, right? You're basically tricking them into believing that they need this manual therapy. And I don't think that's the case, right? I use this every single day. I think it's a very worthwhile skill to develop. If students are being shamed into not doing manual techniques, I think that they're losing a great opportunity to learn a skill that can help a lot of individuals, right? When you're deciding whether or not you need to use manual therapy in your practice, you have to take all these elements into consideration, all right? And unfortunately, it's not a simple yes or no answer. And the amount of manual therapy I use for my patient is going to vary widely based on the individual. So some patients I work with are getting absolutely zero manual therapy, all right? And then in some individuals, it looks like the large majority of the session is manual therapy. If I have a patient that comes in and let's say they have shoulder pain, and then in the first session, we do a really good job of diagnosing and setting up a really, really good plan of care with exercises and behavioral modifications. And that individual can do all their exercises on their own. And when they come to see me in the future, I'll do mostly manual therapies and I'll update the exercise program based on how they're doing, right? And I'm not wasting their time running through the same exercise that they can do on their own. So I think that manual therapy is very valuable from that perspective because folks are going to come in anyway to get their exercise updated. Might as well make them feel a little bit better while they're there, right? So hopefully this was helpful, guys. I know this is a very challenging topic, but yeah, this is what I do. And hopefully it gives you a little bit more information about what you should do for your patients to get them better and back in the gym. Thank you very much for your support. If you're viewing this on YouTube, please give me a thumbs up. I'd love to hear your comments on this, how you treat your patients. If you agree with me, disagree with me somewhere, have anything good to add, please subscribe. It helps me out a ton. If you're listening to this via podcast, please give me a positive rating and review. Helps enormously. And if you want to go the extra step to really help me out, head over to fitnesspainfree.com, go to the program section, and then subscribe to the Fitness Pain Free Insiders. Like I said, get a $1 week-long trial. After that, it's only $9.99 a month. You've got more great learning there. All right, thanks a lot, and I'll see you on the next one.